Good morning, sir and my friends. I'm Jetting, and today I and my partner Suchi will present a topic about robotic exoskeleton. World Health Organization (WHO) points out that every year around the world, between 25,000 and 50,000 people suffer a spinal cord injury. The majority of spinal cord injury are caused by road traffic crash, fall, violence, and sport or work-related injury. Spinal cord injury patients usually face obstacles in their daily life, such as difficulty in breathing, increased urinary tract infections, experience in pain, and also cause depression. Therefore, spinal cord injury patients should use robotic exoskeleton as their for their rehabilitation. Robotic exoskeleton are augmentative devices to enhance the physical performance of the wearer, or also known as orthotic device for guide rehabilitation and locomotion assistance. This enables spinal cord injury patients with appropriate physical ability to stand, walk, or climb stairs. The potential benefits of robotic exoskeleton are endless. Let me introduce myself. I'm first year biomedical science student, and I'm doing a lot of research in this field. Currently, I have learned the most efficient way to recover a spinal cord injury patient through the endocrine and nervous system cause. I have discovered a lot of fun facts through this topic when doing reading and research. So today, I would like to tell you all about the robotic exoskeleton. Before I start the presentation, I hope you all enjoy hearing this topic as much as I enjoy preparing for this presentation. So today, the presentation will be divided into 3 sections, which are introduction of the robotic exoskeleton, the benefit of robotic exoskeleton, and conclusion as well. Let's get started talking about the benefit of robotic exoskeleton. Firstly, robotic exoskeleton increase the bone mineral density. It can maintain our bone health because spinal cord injury patients usually use a power or manual wheelchair as their primary mode of locomotion indoor and outdoor. This often results in a sedentary lifestyle, which will cause 3 to 4% month decline in the bone mineral density in the lower extremities in the first year after a spinal cord injury, and also will increase the risk of fractures. Therefore, robotic exoskeleton promote remodeling of bone as it reduces the mechanical force from both weight-bearing activity and muscle contraction. Based on the Journal of Rehabilitation Medicine that was written by Carolis ID, walking in an exoskeleton may increase the bone mineral density up to 14% in the tibia with 6 weeks of training. There was 1 out of 5 participants have an improvement in bone mineral density, and which shift his diagnosis from osteoporosis to osteopenia. Now, my partner Sichin will continue to talk about the benefit of robotic exoskeleton.
Thank you, Jetting, for the first main point. And now, I will introduce the second benefit of the robotic exoskeleton, which is to improve the quality of life. Maybe you will have a question here, how the robotic exoskeleton can improve the quality of life. So let me introduce more detail to you. First of all, a robotic exoskeleton can help SCI and paraplegic patients by allowing them to perform physical activity, especially walking. According to a BBC News on 4 October 2019, a man has been able to move all 4 of his paralyzed limbs with a mind-controlled exoskeleton suit. As we know, prolonged sitting time will cause cardiovascular disease, cancer, and also increase all-cause mortality. In this aspect, a robotic exoskeleton can reduce the risk of disease indirectly. This is because it can encourage the physical activity of the patient. Robotic exoskeleton can also decrease sitting time and improve the physical activity parameters of the patient. As a result, a robotic exoskeleton can improve the patient's quality of life, not only allowing them to do the physical activity such as walking and exercising, but also can reduce the risk of getting disease. In addition, a robotic exoskeleton can improve the quality of life by helping patients rebuild their self-confidence. An article by ISESE, which is International Symposium on Energy, Environmental Science and Engineering, did express this idea. Based on the article, a robotic exoskeleton can improve the walking ability of patients by simulating a real walking environment and touch the ground feeling. Therefore, it can stimulate patients to strengthen their motion control and make the exoskeleton a good rehabilitation tool. This training method can improve patients' self-confidence and stimulate their interest in rehabilitation training. So let me end by concluding the points that we talked about just now. In short, a robotic exoskeleton brings a lot of benefits, which include increasing bone mineral density and improving the quality of life. Therefore, the robotic exoskeleton would be one of the best rehabilitation tools that can recover SCI, paralysis, or even stroke patients efficiently and safely. That's bring me to the end of our presentation. Hope you all learned something new today. Thank you for listening.